prevention, enforcement, and reentry. Those three prongs are essential that they be together because we have to prevent what's going on. We can't just lean on enforcement. When we talk about violence, everybody wants to go right to enforcement, right? Because we want an answer right now. But there will always be more people choosing a lifestyle of violence if we don't stem the tide back in the prevention stage. Prevention is run by the Erie County Policy and Planning Council, which is a collaborative that works on preventing problem behaviors. Their scope is broader than just violence, but they're working on all different issues that lead to problem behaviors.
The Erie County Policy and Planning Council for Children and Families has been around since 1996. It was established under the Judy Lynch administration through Erie County, primarily with the charge to address issues with youth and family within our areas in a collaborative manner. It wasn't until 2011 that the Erie County Policy and Planning Council partnered with the enforcement and reentry efforts to become what we now know as UnifiedErie. The Erie County Policy and Planning Council follows a model called Communities That Care. And essentially what Communities That Care is it's a national model for prevention planning. And it is a public health model approach to addressing problem behaviors among our youth.
The Communities That Care cycle allows us to take data from the Pennsylvania Youth Survey, run it through a grid, and actually figure out what our biggest problems are and work on fixing them, and figure out what our missing protective factors are that if they were present in the lives of kids, they would do better.
So the Communities That Care model is a data-driven approach. And when we talk about data-driven, what we mean by that is that we're not just guessing at what the issues are. We are looking at those issues from a data perspective, not just from numbers, but actually from information that we get from the youth and families within our own community. We don't want to just pick issues that are on a national level that are issues. We want to know what our issues are here in Erie. And so that's when we refer to data-driven, that is what we are referring to. We look at that information and then we also determined what are our higher priorities within Erie County. And then we also go through a process of identifying what already exists within the community that are addressing those issues. And then from there, we look at what are we missing in our community? What strategies, what policies, what approaches are we missing within our community? And then that's where we develop a community action plan to actually address what those issues are, those gaps, those barriers to service.
Then, brilliant people get together and they actually write a plan. 60 to 100 people contribute and work on this plan every 2 years. Once the data has been boiled down and we know what our top 3 problems are, and our missing 3 protective factors are, they actually sit down and say, okay, what are we going to do about it?
And so when we talk about evidence-based, which is a term that is thrown around very frequently, we're talking about using strategies that are known to work. When you are, for instance, looking to embark upon purchasing a new kitchen appliance, making an investment in a washer or a dryer or a dishwasher or refrigerator, oftentimes we'll look at the reviews before we make that investment and make that purchase. Well, that's what we do with evidence-based programs as well. We want to make sure that they are proven to work, that they are proven effective, that they have worked and impacted the issues that we need impacted in our community, but they've done that elsewhere. Oftentimes people get concerned about that issue of evidence-based, but that's what we're talking about. We're looking at the reviews of these programs and services before investing in them here. Because we do have such limited resources when it comes to funding and when it comes to other resources within the community. And so we want to make sure that we are investing those resources wisely. So the Erie County Policy and Planning Council is not its own 501c3. It is a group of stakeholders, of community members, of people who represent organizations and services and systems and neighborhoods who come together to address these issues in a collective manner. Because through collaboration is how we can effectively move the needle in a more impactful manner. The issue becomes is that we don't all individually have the resources that are necessary in order to reduce the violence within our community. We all have a role to play in that. And whether it's our individual hat that we're wearing, or our parental hat, or our family hat, could be our neighborhood hat that we're wearing. Maybe it's a hat that we wear when we belong to a certain social club or a faith-based institution. We all play different roles and have different roles to play when it comes to implementing strategies and addressing the issue of violence within our community.
Part of what we have to keep in mind with prevention is it's a long-term game. Prevention, unfortunately, is not something that we get to see the results tomorrow. But what I can tell you is that the model that we're following has been studied, and every community that implemented it with fidelity, implemented it and stuck with it for 10 years, has seen a significant change in their outcomes, in their problem behaviors. We're 3 years into a 10-year plan on the prevention side of UnifiedErie. And I am convinced that when we reach the 10-year mark, we are going to be able to turn around and look back and say, look how far we've come.
The prevention end is pivotal in the reduction of violence, but the prevention efforts are not going to be outcomes that we're going to see overnight. They are going to be outcomes that we are going to see over time.